Think erectile dysfunction is a natural part of aging or only affects older men? Think again. Today we're diving deep into the mystery of erectile dysfunction, or ED, to debunk some common misconceptions that often cloud understanding of this condition. One of the most prevalent myths is that erectile dysfunction is strictly an older man's problem. The reality is it can affect men at any stage of life. Yes, the likelihood may increase with age, but young men are not immune. ED is not choosy. It doesn't discriminate based on age. Another fallacy we often encounter is the belief that erectile dysfunction is just a part of aging, something to be expected and accepted. Let's set the record straight. While aging can contribute to the occurrence of ED, it is not a guaranteed or natural part of growing old. Many men maintain their sexual function well into their senior years, so if you're experiencing ED, it's not something you should simply shrug off as an inevitable part of aging. Now, let's shift gears a little and introduce a crucial fact that many people overlook. Erectile dysfunction can be a sign of other health problems. It could be your body's way of waving a red flag, signaling issues like heart disease, high blood pressure, diabetes, or even psychological conditions like anxiety and depression. So, it's essential to view ED not just as an isolated issue, but potentially a symptom of broader health concerns. As we delve further into this topic, we'll explore more about the causes and risk factors of ED, as well as the various treatment options available. But for now, let's remember, erectile dysfunction is not just an older man's problem, and it's certainly not a natural part of aging. It's a complex issue that can affect anyone, and could be indicative of other health conditions. As you can see, erectile dysfunction is a complex issue that affects men of all ages and can be a sign of other health concerns. Stay tuned as we continue to unfold the layers of this often misunderstood condition. So, what do experts say about erectile dysfunction? Let's find out. Erectile dysfunction, or ED, is a topic that's often shrouded in misconception and stigma. To clear up the confusion, we've turned to the experts, urologists, psychologists, and lifestyle coaches, each with their unique perspective on this common condition. Firstly, urologists, the doctors who specialize in the urinary tract and male reproductive system. They're quick to underscore that ED is not just a psychological issue. In fact, it's often a symptom of an underlying physical condition like heart disease, high cholesterol, diabetes, or hormonal imbalances. Urologists emphasize that ED should be treated as a medical condition that warrants professional attention, not something to be brushed under the rug. Psychologists, on the other hand, highlight the psychological factors that can contribute to ED. Stress, anxiety, and depression can all play a significant role in triggering or exacerbating erectile dysfunction. They stress the importance of mental health in maintaining sexual wellness and encourage men struggling with ED to consider seeking help from a mental health professional. Our lifestyle coaches bring a different lens to the discussion. They talk about the role that lifestyle factors like diet, exercise, and sleep play in maintaining healthy erectile function. A balanced diet, regular exercise, and good sleep hygiene can all contribute to overall health and wellness, which in turn can support healthy erectile function. They also caution against excessive alcohol consumption and smoking, both of which can contribute to ED. The consensus among these varied professionals is that ED is multifaceted and can be influenced by a combination of physical, psychological, and lifestyle factors. And importantly, they all agree that it's not something to be ashamed of or ignored. Experts agree, erectile dysfunction is a treatable condition and it's important to seek help. So if you or someone you know is struggling with ED, remember that there are professionals out there who can help navigate the path to recovery. Now that we've heard from the experts, let's delve into the possible causes and risk factors of erectile dysfunction. Before we start, let me be clear, erectile dysfunction doesn't discriminate. It can affect men of all ages, and it's often the symptom of an underlying health issue. The causes of erectile dysfunction can be broadly categorized into two types: physical and psychological. Physical causes are often related to the body's ability to facilitate an erection. This could be due to conditions that affect blood flow to the penis, like heart disease or high blood pressure. Diabetes too can lead to erectile dysfunction, as it can damage the nerves and blood vessels in the penis. Another physical factor to consider is hormonal imbalance. Low testosterone or thyroid hormones can impact your body's sexual response. In some cases, certain medications or treatments, like those for prostate conditions or depression, can also contribute to erectile dysfunction. But let's not forget about the psychological causes. Stress, anxiety, and depression can take a toll on your mental health, and this can manifest as erectile dysfunction. This is because the brain plays a key role in triggering the physical reactions needed for an erection, and these emotional states can interfere with these processes. Now let's talk about lifestyle factors. Unhealthy habits like smoking can damage blood vessels, hindering blood flow to the penis. Regular heavy alcohol use can also interfere with the normal functioning of the sexual organs. Lack of physical activity or a poor diet can contribute to conditions that lead to erectile dysfunction too. In some cases, erectile dysfunction can be a combination of these factors. It's also important to note that aging is a natural risk factor. While it's not guaranteed that all men will experience erectile dysfunction as they age, the risk does increase. Understanding the causes and risk factors of erectile dysfunction is the first step towards managing this condition. So whether it's a physical or psychological cause, or a lifestyle factor, acknowledging these potential triggers can help you take proactive steps towards managing and potentially improving erectile dysfunction. Erectile dysfunction might feel like a big problem, but there are many treatment options available. In our journey to tackle this common issue among men, let's now dive into the world of treatment options. Now, don't be overwhelmed. Remember, the best treatment varies from person to person, and it largely depends on the underlying cause of the erectile dysfunction. First up, we have lifestyle changes. Yes, you heard it right. Sometimes all it takes is a few tweaks in your daily routine. This could mean regular exercise, a healthy diet, adequate sleep, and limiting alcohol and tobacco use. These changes not only improve your overall health, but also boost your sexual function. Next, we have psychological counseling. If the root cause of the problem is stress, anxiety, depression, or relationship issues, talking it out with a mental health professional can do wonders. They can help you navigate your feelings and find effective coping strategies. Now, let's talk about medications. There are several FDA-approved drugs available that can help men achieve and maintain an erection. These include sildenafil, tadalafil, and vardenafil, among others. They work by enhancing the effects of nitric oxide, a natural chemical your body produces that relaxes muscles in the penis, allowing for increased blood flow. In some cases, testosterone replacement therapy might be needed, especially if low levels of this hormone are the culprit. This treatment involves supplementing the body's natural testosterone production. If other treatments don't work or aren't suitable, there are surgical options. Penile implants or vascular surgery can be considered, though these are typically last resort options due to their invasive nature. Remember, it's important to consult with a healthcare provider to determine the best treatment plan for you. They can provide a comprehensive assessment and guide you through the process. With all these options, it's clear that erectile dysfunction doesn't have to be a life sentence. It's a manageable condition, and many men have found successful treatments that have improved their quality of life. With the right treatment, erectile dysfunction can be managed effectively. We've covered a lot of ground today, so let's recap. We've taken a deep dive into the often misunderstood world of erectile dysfunction, breaking down the veil of mystery that often surrounds this condition. We've established that erectile dysfunction is not an isolated issue, but a common condition that affects men of all ages and walks of life. We've engaged with expert opinions, learning that this condition is not a sign of weakness or a reflection of masculinity. Instead, it's a medical issue, just like any other, and it's important to approach it as such. We've explored the numerous causes and risk factors, understanding that it's not always about lifestyle choices or age. Sometimes it's about underlying health conditions, psychological issues, or even side effects from certain medications. Then, we delved into the myriad of treatment options available. We've learned that it's not a one-size-fits-all situation. From lifestyle changes and counseling to medications and surgeries, there's a wide range of solutions to suit individual needs and circumstances. But perhaps the most important takeaway from our discussion today is this: erectile dysfunction is treatable. It's not a life sentence or something to be ashamed of. And you're certainly not alone in this. Millions of men across the globe are in the same boat, and many have successfully navigated their way out of it. So if you're experiencing symptoms, don't hesitate. Reach out and seek professional help. There's no need to suffer in silence or let this condition take a toll on your self-esteem, your relationships, or your overall quality of life. And remember, this isn't just about sexual health, it's about overall well-being. A fulfilling, satisfying life is possible, and it starts with taking that first step towards seeking help. Remember, it's not just about sexual health, it's about overall well-being. Don't let erectile dysfunction define you or your relationships. Seek help, get treated, and live a healthy, satisfying life.